This is a chronic state where the patient suffers from frequent, urgent, and lethal urination, which worsen when they are nervous. Needless to say, the patient is also very nervous. Symptoms are aggravated by young causes, such as after coffee or tea, less sleep or overwork, etc. We have here the clinical example of a female 23 years old. Sabi ng author, I saw this patient in a course of 20 medical students. The patient was also a student and her problem was that she passed urine 2 to 3 times per hour. She could not go on any journey if there was no toilet on board for fear of an accident. If she went for a social get-together, she had to first find the toilet. And as long as she stayed near it, she could relax. The problem had appeared and worsened in the time she had been a university student. The urologist had investigated her and had suggested dilatation of the urethra. She was to have this procedure in 2 weeks. In the meantime, a friend who was attending our course had suggested that she try acupuncture. Sabi ng author, I noticed that the patient was pale and tired. I asked her how much water she drank. She said that she only drank coffee and tea more than 15 cups a day. She really needed this or she felt very tired. It was quite clear that her caffeine consumption had increased through the years in the university and so had the nervous urination. I suggested to her that I might be able to help her if she would give up drinking coffee and tea for 2 weeks. She looked bewildered and said, but what should I drink instead? Sabi niya, water, of course. She agreed as it was only for 2 weeks. We treated her 3 times per week for the next 2 weeks, at the end of which she passed urine only 5 to 6 times in a day. At the end of the 2 weeks, we sat down and explained to her how the bladder becomes hyperactive and irritated by excessive caffeine and alcohol, and that had been her problem. She slowly took it in and then asked if there was no compromise. I suggested that she could ration her drinks, 1 coffee and 2 teas per day, just when she needed them most. Now that her bladder was not the problem, she could do some sports. This would help her energy level. Nervous bladder, the urinary bladder, there is an excess of yang deficient yin. Nervous bladder would not be confused with frequent night urination. The latter worsen at night and disturbs sleep and is a kidney yang deficiency symptom. Nervous bladder is worst when the patient needs to go out or when they are excited. It is better at night when they are asleep. So sa treatment points, REN 3, move front point of the bladder, cools and calms the bladder. Spleen 6, the area distal point. Kidney 4, the loop point of the kidney tonifies yin and sedates yang. UB40, the earth point, grandmother point of the UB, tonifies yin. Do20, liver 3, tranquilizing point and point against nervousness. Kidney makes marrow. Marrow is the substance of the bone or the bone marrow and the brain and the nerves brain or nerve marrow. This substance is associated with the kidney yin. Symptoms such as fractures and caries in teeth, showing weakness of bone marrow or osteoporosis, and nerve atrophy, Alzheimer's disease, multiple sclerosis, showing reduction of nerve marrow, are examples of kidney deficiency. Symptoms such as stiffness of joints and edema in wet and cold weather and hydrocephalus indicate yin excess. Arthritis, osteoarthritis, backache, neuralgia, paralysis are all problems of bone and nerve marrow. Muscles and tendons are associated with the liver. Therefore, a pain or problem relating only to muscles and tendons should be treated in the liver meridian. Skeletal pain needs to be treated on the kidney meridian. Pain in the joint should be treated on both kidney and liver meridians.